The kidneys are fascinating and complex organs when we have kidney disease. Not everything goes when it comes to nutrition, and I always say that taking care of our kidneys' health is a priority. In today's video, I'm going to show you up to 6 foods that you shouldn't try, that you shouldn't eat, or that you should reduce when you have kidney disease. Stay until the end, because this video will interest you. How are you? This is Dr. Borja Bandera. Today we're talking therefore about kidney health. The kidneys are fascinating organs whose main mission is to filter the blood. They are constantly filtering the blood. Liters and liters and liters of blood pass through the kidneys every day and the kidneys. What they do is remove waste substances and toxic substances and keep what is useful. That is, for example, amino acids are useful. When they pass through the kidney normally reabsorbs them, returns them to the blood, and does not let amino acids or proteins be lost in the urine. Why? Because they are useful. Glucose is also useful, it's energy, so normally it is not lost in the urine. Unless blood sugar is excessive, as in diabetics, or medication is taken to cause it, it is reabsorbed into the bloodstream. Why? Well, because they are useful substances. The kidney always keeps what is useful and eliminates what is toxic or what is a metabolic waste. Also, it doesn't stop there. The kidney, I repeat, is one of the most complex organs that exist. It also produces some hormones and activates other hormones. There are hormones like vitamin D that without proper kidney health don't work. They don't get activated. They're not biologically active. And also, it plays a role in something that's also super complex, fluid balance. All of this means that without kidneys or without proper health of our beloved kidneys, what's called homeostasis can't happen. The kidneys are one of the organs that contribute the most to that homeostasis, to that balance of the internal environment. Nowadays in the West, there are many risk factors that increase the risk of developing kidney disease, but by far the two most important are high blood pressure and poorly controlled diabetes. Some others are alcohol, obesity, or excess body fat in general, or certain viruses like the hepatitis C virus or human immunodeficiency virus. Guys, when we talk about kidney disease, we can't generalize. That is, there isn't just one kidney disease, just like there isn't only one type of cancer. There are many types of cancer, and each one is a different disease with its own characteristics and peculiarities. The same happens with kidney disease. There are up to 4 situations that we can classify within kidney disease, and each of the following 4 situations that I am going to mention. Pay attention, it's different and requires special care. For example, the first would be acute kidney disease, a kidney disease in which there is a cause, for example, very acute dehydration that is causing kidney failure. Momentary, circumstantial, limited to a specific moment and a certain risk factor, and that can usually be resolved later. Then comes chronic kidney disease, that is a disease that already lasts, that persists over time. We have to distinguish at least between chronic kidney disease in the early stages and chronic kidney disease in the advanced stages. Because nutritional and lifestyle recommendations vary greatly. For example, a person with chronic kidney disease in a very early stage, right at the beginning, we wouldn't impose a major restriction on protein intake, whereas in a person who already has advanced chronic kidney disease, we would. In addition, we also have a 4th situation that's very important to mention, which is dialysis. Just so you get an idea, protein consumption, the need for protein, increases during dialysis, while in advanced chronic kidney disease it's reduced. And what about chronic kidney disease in its early stages? Well, it can be very similar to the recommendations you would give to someone who doesn't have any health problems. That's how complex chronic kidney disease is, but today we're going to focus on a series of foods that are not very advisable. In which of the 4 situations I just mentioned? Well, especially in this one, in advanced chronic kidney disease, because of early chronic kidney disease. In the early stages, the recommendations don't differ much from those of a healthy diet aimed at the general population for anyone who has this problem. But when we get to a glomerular filtration rate below 30, and the lower it is, the more valid these recommendations become. Yes, these recommendations and nutritional guidelines do change. I want you to pay attention because there are 4 nutrients that you need to keep in mind in chronic kidney disease. When the kidney doesn't work well, I said that the kidney filters the blood. I said it at the beginning. It removes toxins and waste products and keeps what is useful. Well, the kidney is responsible for keeping the amount of sodium, salt, potassium, and phosphorus in the blood balance, which also has the symbol P. So I keep writing P, but well, I'll put phosphorus here in parentheses, and also the amount of protein here is very interesting. Sodium, potassium, phosphorus, protein, S3P, sodium, potassium, phosphorus, protein, sodium, potassium, phosphorus, protein, S3P. This is what you need to keep in mind when we talk about which foods you can eat with kidney disease and which foods you can't eat. In general, sodium and potassium are not recommended to exceed 2000 milligrams per day of sodium or potassium. Phosphorus is not recommended to exceed 800 milligrams per day, and protein is not recommended to exceed 0. Eat 0.8, 1/100th of an ounce per kilogram per day of protein in advanced chronic kidney disease. So now, after this physiological introduction, after you've understood a bit more about the function of the kidneys, I want to explain and show you up to 6 foods that you should avoid or reduce your consumption of. A lot in advanced chronic kidney disease. The first one for me is a pandemic, not only in chronic kidney disease, but also in the general population. It's a consumable that doesn't provide any real nutritional value. Carbonated soft drinks. The carbonated soft drinks, the additives and colorings in these drinks contain a lot of phosphorus. Remember that 3P, phosphorus? Phosphorus. When the kidney is sick, its level in the blood increases and it can cause many problems. In fact, it does. One of the main limiting nutrients in chronic kidney disease is phosphorus. When phosphorus increases, so does the blood in chronic kidney disease. Bad. Well, these additives and colorants contain a lot of phosphorus, but also that phosphorus is absorbed more easily, because it is in the form of phosphorus salts, like sodium phosphate. And these are phosphorus salts that are easily absorbed in the digestive tract. They have very good bioavailability. They are absorbed very well. A can of any soft drink, especially those with darker colors, can easily contain 150 milligrams of phosphorus. That's a very high amount. Guys, remember, the limit is 800. A couple of cans can already reach about 300 to 400 milligrams of phosphorus. That's without even considering the food's contents, which we'll discuss now. The second food is, will it surprise you? Avocado or palta? My mouth always waters when I talk about avocado because it's a really good food. It's a very generous food, a very healthy food. Why? Well, for many reasons. Among them, its content of healthy fats, MUFAs and PUFAs, monounsaturated fatty acids, and polyunsaturated fatty acids. Avocado is healthy for the general population. What issues arise when kidneys function poorly in chronic kidney disease? There is the problem that 100 grams of avocado contain the tremendous amount of about 600 milligrams of potassium. It's a huge amount. Potassium is healthy under normal conditions, but remember, the limit is about 2000 milligrams per day in chronic kidney disease. Therefore, just 3½ ounces of avocado and some way more would provide 600 milligrams of potassium. Guacamole also has that problem, and it usually contains salt, which is sodium, so it would be a bad combination. Too much sodium and potassium. Therefore, avocado, I repeat, is very healthy for the general population, but not very healthy if you have chronic kidney disease. Third food, canned foods. Once again, canned foods are very healthy if you don't have any kidney problems. I'm discussing pickles, legumes, and canned fish, which I usually recommend, as you know. Why are they negative in chronic kidney disease? Well, because they also contain a lot of sodium. Sodium is added as a preservative, that's why they're called preserves. These foods are better preserved with the sodium that's added. However, there are increasing numbers of low-sodium alternatives available nowadays. If you have the option to choose a low-sodium preserve, you would be minimizing this risk. Guys, another thing you can do is something much simpler, easier, and that costs €0 or $0. It's draining and rinsing the product, draining and rinsing. Legumes, canned fish, pickles, we managed to reduce the sodium content by 80%. Let's move on to the fourth food, also generally healthy, but be careful with it in chronic kidney disease. The banana, a medium banana, not too big or too small, contains 400 milligrams of what? Of potassium as well. You're correct. Bananas are widely known as a potassium-rich food that's often recommended for athletes. Why? Because of its potassium content, since it is indeed rich in potassium, 400 milligrams of potassium in a medium banana. What is a good alternative? What is a good alternative to bananas in chronic kidney disease? Well, for example, pineapple. Pineapple contains much less potassium. The fifth food is milk. A glass of milk contains about 220 milligrams of phosphorus and 350 milligrams of potassium. Also, it happens that, paradoxically, you might think that milk is always recommended to keep your bones strong. But what happens in chronic kidney disease? The following happens. Pay attention. When we consume a lot of phosphorus in chronic kidney disease, this phosphorus is not properly eliminated by the kidneys. As I said, it rises in the blood. Phosphoремia, the levels of phosphorus in the blood increases. This causes a hormone to respond and increase, which is parathyroid hormone, parathyroid hormone, the parathyroid hormone. Some glands are produced that are next to the thyroid gland, here in the neck, which is the parathyroid gland, which produces the hormone of the same name. This hormone, when phosphorus increases, also increases. We call this tertiary hyperparathyroidism, or that derived from chronic kidney failure and this hyperparathyroidism. What it does is take the calcium from the bones and move it into the blood. Increasing calcification, the risk of calcification of tissues and structures, such as, for example, the kidneys, also worsening chronic kidney failure and in turn weakening the bones. Because we take the calcium from the bones and the bones become demineralized, they lose bone mineral density. Very important. Alternative milk options include plant-based milks like rice milk and almond milk. However, watch out for the sugar content, because sometimes they trick us with the amount of sugar in these plant-based milks. And finally, the last food or group of foods. But perhaps one of the most important ones I'm going to talk about today is processed meats. Processed meats are generally unhealthy and are consumed a lot. They increase the risk of diabetes, metabolic syndrome, cancer, and certain neoplasms like colon cancer. They are generally unhealthy and not recommended, whether you have chronic kidney disease or are a perfectly healthy person. We should reduce our consumption of hot dogs, bacon, and sausages. Do we consume excessive amounts of processed meat? Well, even though it tastes really good, it contains carcinogenic compounds, too much salt, too much phosphorus, and also quite a lot of protein. Remember, sodium, potassium, phosphorus, protein. Sodium, potassium, phosphorus, protein. Well, processed meat pretty much packs in all of these elements, except for potassium. And therefore, frequent consumption of processed meat, guys. Besides being negative for the reasons I've mentioned, it's very harmful in chronic kidney disease. We've discussed the kidney, a fascinating organ. There's more to it than what we've covered. If you want a part 2 comment, let me know. I read your comments, but I can't always reply. There are hundreds and hundreds and hundreds of messages every week, and I prefer to focus on The reason for creating content is to enable live streams on weekends for one-on-one discussions. What do you have to do to participate in the live streams? Well, join the channel's members community. Now then, a quick summary in less than a minute of the video. We've seen that the kidneys filter the blood, remove toxic products and waste substances, and retain what is useful. They produce hormones or activate hormones and are involved in fluid balance. We've said that it's important to differentiate between acute and chronic kidney disease in their early stages, advanced stages, or dialysis. And we've talked about some foods are very unhealthy due to their high sodium, potassium, phosphorus, or protein content, or in a combination of all four. Carbonated soft drinks, avocado, canned foods, plantain or banana, milk and other dairy products, and processed meats. That's it for this video. See you next time. Thanks for watching till the end. Keep empowering.